Hello, Victoria. I'm so sorry we weren't able to live it tonight, but I promised people that I was going to bring you an experience, and I'm not breaking a promise to my people. And that experience was to bring an expert in the oral microbiome. So I've talked live, my team's talked live. I've lectured so many times about the gut microbiome. It kind of falls out of my mouth like, most people are reading Mills and Boon. I can talk about the gut microbiome. And it's something that hundreds of books have been written about, and most people at least understand the concept. But the oral microbiome is like a whole new love language, isn't it? It's a whole new language. And when I went to go live, I introduced you as an expert. Now, you might not call yourself an expert, but I am going to call you an expert because I got to hear you live in London in the summer when we were having a microbiome day. So you were talking oral microbiome, then I followed on the gut. And I said it on the day, and I still stand by it. I nearly didn't perform because I was like, I just got to go sort out my teeth. I haven't even got a chance to go do my lecture. So listening to you speak really made me see that whilst there's not many experts out there who understand dentistry and understand teeth, but also understand what that mouth and what those teeth are bathed in. But you've nailed it. You've got both areas to it, haven't you?
Well, I'm trying my best. Thank you. I think you are right. It's very new and quite niche. You've got a lot of your very bog standard dentists, and then you've got your microbiologists, and it's not often that they kind of combine together, but similar to, I think, with, medicine, now people are really starting to understand that the microbiomes are really what are in control of disease and of health as well. So if you really want to be a real proper dentist, you should really understand what is causing that disease in the first place.
Yeah, amazing. I love it. That's a great starting point. Now, I know I've sent plenty of clients your way where I've opened up the dialect that I think they've got a microbiome issue, whether that be a symptom such as autoimmunity, cancer, which I see sadly way too much of. It is my specialist subject, right down to even children with microbiome disturbances. I've got autistic children who are having teeth pulled out like there's nobody's, so out of balance. And yet for years we've been ascertaining gut microbiome, and it's only really in recent couple of years that we've been able to embark on testing their oral microbiome. But can I ask you, from your perspective, what do you see when somebody opens their mouth? Because you can't see the bacteria; it's not visible. So, what do you see that makes you think there's a microbiome issue? Why did you even pick up an interest in oral microbiome?
Well, so in terms of why I decided that I loved bugs so much, it all started actually during COVID. Before that, I would say I understand the connection between oral and general health, but I didn't get that kind of the bridge between them. What was the connection between the oral health and the rest of your body? And then during COVID, I started doing some research. I wasn't working as a dentist. We weren't allowed to. And so I started a research trial where we were looking at whether or not gum disease increased the risk of COVID complications. And the kind of the puzzle piece was the oral microbiome. And so I wrote a paper, and it was the first in the world to connect oral health with COVID, and to kind of put the mouth into the conversation. And after that, I was approached by a couple of universities who said, hey, we really want to do some research with you. And so we actually went into ICUs and we started testing the microbiomes of COVID sufferers who were being incubated. And what we were finding was that the oral microbiome was absolutely like whack, like it was just all over the place. And what we were also able to see was that patients who may have had maybe mild to moderate COVID symptoms who were still being hospitalized, those who had very dysbiotic oral microbiomes had a much higher risk of being incubated and having severe complications later on. And so that's when we realized, okay, so a dysbiotic microbiome can definitely, contribute to other general diseases. And that opened the doors for oral microbiome testing for me. I started to understand that actually, the bacteria in your mouth, it doesn't just stay there. And first of all, it can travel through your saliva and your blood elsewhere to distal sites and cause disease elsewhere. But also even the effects of having bad bacteria in your mouth were enough to trigger other issues, so such as inflammation. And if you have very high levels of bad bacteria in your oral cavity, then they will release inflammation, and you get low-grade chronic inflammation, which can just contribute to other inflammatory diseases elsewhere in the body.
Yeah. Like the autoimmune diseases, the ICD-10 thing, like the cancers, like the cardiovascular diseases, and actually, sadly, even down to things like Alzheimer's and dementia, which are just chronic brain inflammation.
Exactly.
Wow, that's amazing when thinking about it from an oral microbiome. And obviously, because nobody knew COVID was coming, there was no means of preventing it by working on the oral microbiome. So when you were able to go back into dentistry, doors opened up and you could kind of go back to your, bread and butter treatment. How different did that make you look at the person sitting in your chair, not the person sitting in the ITU bed that had kind of started this whole investigation?
Well, I just became very prevention based, and I thought, okay, how can I make sure that my patients don't end up in ICU? And one of them was to balance their oral microbiome. And then I realized that the after effect of that was that their oral diseases were also eradicated, and their other general diseases were improved as well. So I started doing oral microbiome testing on most of my patients, and then doing kind of localized treatments for each bacteria in their oral microbiome to rebalance it. And that's when I started working with nutritionists and functional practitioners and doctors, and they were sending their patients to me and saying, hey, my patient has rheumatoid arthritis and, they have had 6 teeth taken out in the past year. Can you help them? And then realize that they have, horrific gum disease. Their inflammation is off the charts. And just with something as simple as good dental treatment, reducing their inflammation through, I've got a lot of tricks up my sleeve, but essentially cleaning out the bad bacteria and rebalancing their oral microbiome, we were able to see improvements in their mouth, but also in their arthritis or in any other disease that they were also suffering from.
That's phenomenal. So I'm guessing like what the doctor might have been seeing was low-grade inflammation on their labs, as well as, symptoms, joint inflammation, et cetera. But what you were seeing was the manifestation of it coming from their mouth. And I'm guessing, I'm thinking of a client that I sent your way with MS and a horrific oral microbiome, but she wasn't losing teeth all over the place. And whilst she gave me a few little snippets that made me think, I need to look at her oral microbiome, then saw it and was like, I know where I've got to send this lady. I didn't open her mouth up because I was doing telemed with her. But her teeth weren't falling out all over the place. So it isn't always as profound as great big red raw gums and wobbly teeth and dentures, is it?
No, so some signs of a dysbiotic microbiome. The most severe is losing teeth. Then you start seeing maybe wobbly teeth, bleeding gums. You should never have blood in your basin when you brush your teeth. Never. That's not normal. And a lot of people seem to think it's okay to have once in a while, but that is a huge sign of inflammation. Bad breath, or sometimes even a sweet smelling breath as well. An aftertaste. Even a tongue which has a kind of abnormal coating on it or a different color. If you're getting ulcers a lot or randomly, that's another one, or just soreness. So those are like the big clinical signs that I would see in the mouth, which would make me think, this person needs to, their microbiome is not balanced. Also decay. So if a patient has lots and lots of decay and they keep on saying to me, I never have sugar, I don't know what you're talking about, I have a great diet. And one of the problems with the oral microbiome is that you can have, and similar to the gut, I assume, is that you can have pathogenic bacteria, which can be causing disease in your mouth. And whilst the habit may have stopped, that bacteria might still be there. And so you do need to kind of have some focused treatments to get rid of those bacteria. And you might find that after that bacteria is gone, that their levels of decay have gone down, that their gum disease has gone down. Because, if you were a smoker, I have a lot of patients who are maybe in their 40s, 50s, and when they were at university or they were young, they smoked 20 cigarettes a day, they were eating sugar all day, and, they had bad habits. And their microbiome reflects those bad habits even 20 years on. And so they need...
When they've stopped smoking and they've stopped the sugar habit, but
Exactly.
because they've not corrected the imbalance is still there. Yeah, that makes so much sense. And I mean, honestly, who hasn't had a bad habit, whether it is smoking or alcohol or fizzy drinks or sugar? There's not many people who's going to be listening tonight and be like, I've been a saint my whole life.
No.
So actually that makes me think each and every one of us needs to be thinking about our microbiome, don't we?
Yeah, 100%. Like you said, everyone has had a bad habit, and it's fine. It's normal, but it's about, one of the problems is that a lot of those bacteria are stuck underneath the gums and they never are released or changed. And even if you start, throwing mouthwash into your mouth, it's not necessarily going to be aimed at those specific bacteria, or they don't even reach that bacteria because they're too deep under the gums.
Yeah. So I'm not going to ask you to give away all of your secrets, because I'm sure the dentist might be listening to this. And I've never met anybody like Victoria, and I want my clients to go to her. But what I'd just like people to hear, and I've actually got a guy in Switzerland who's just had his oral microbiome test back. And I'm like, how much can I persuade you to get on an aeroplane and get into London to see Victoria? That's how much I'm like, I don't think we're going to find you in Switzerland, so I need to bring him to you. But can you just explain a little bit, just maybe the concepts of, I think I went to the dentist a couple of weeks ago for a checkup. Interesting, I tried to embark on a conversation with my dentist about oral microbiome because I was just in the middle of writing a lecture deck as I left to go to my appointment on neuroinflammation. And I said, funnily enough, I've just walked away from talking about the link between oral hygiene and Alzheimer's disease. And he was a bit like, I think I thought I'd lost the plot. But anyway, so, he's a very good dentist. No question over his dentistry skills, but I do question his ability to see the whole of well-being. So what would you do differently? Somebody'd come in, you'd do exactly the same. You'd do a workup, you'd ask them loads of questions, I'm sure, about their habits, about their symptoms. You'd open up their mouth. What else would you do that's different? Why are you so unique once I walk into your office?
So firstly, we do the oral microbiome testing, and then we also look at other enzymes as well in the saliva. So I look at specifically collagen breakdown. An issue with gum disease is that you often only see gum disease once it's too late, once there's destruction. And a lot of disease in the mouth is silent, or it's not visible. So collagen breakdown and the enzymes will show that there's gum disease starting or how bad it is. And I'm quite a numbers person as well. So I like everything quantitative. I don't like to kind of be like, oh, I think there's a bit of inflammation. I want to know exactly what inflammatory markers there are, what bacteria, the enzymes. So we do a full workup in that sense. If we think that the patient needs a blood test, we'll also send them off for a blood test. And that's where it works really well with someone like you, for example, where you are already sorting everything else out. And so I have access to all of those other results, and I usually don't have to do much in that sense. But it's about teamwork. And if you're balancing the gut and I'm balancing the oral microbiome, we're going to have a much better result than if you were to just do it alone. And then based on the results of all of that, we will then do specific treatments based on the bacteria that are present in the microbiome. So if the patient has severe gum disease and high levels of terrible bad bacteria, then we might add some supplements, nutrition as well. So aimed at the bacteria. So I don't know, for example, green tea for, Fusobacterium, and this for that bacteria. And then we do specific treatments in the chair as well. So one thing I do a lot of is guided biofilm therapy. And that's basically where we disclose the whole mouth and we put a plaque disclosing tablet. So it shows all the bacteria and biofilm in the mouth. And that will help the patient see where they're brushing well or where they're missing, but it also allows me to be guided to remove the biofilm properly. And then we use an antibacterial spray, which is erythritol. And we spray the erythritol, and that will actually selectively remove the pathogenic bacteria, but maintain a good balanced microbiome. And then also sometimes laser treatment if there's really, really bad gum disease and we need to get rid of very deep bacteria in the pockets. And I'll also put them on like a regime. So maybe some mouthwash for a couple of weeks. So I call it like the purge. So I get rid of all the bad bacteria in the oral microbiome. And then afterwards, probiotics and re-nourishing and maintaining that microbiome. And then we test and maintain. And the beauty of having those numbers is that we can actually track that patient and see, before and after in 6 months, how things have changed. And I think that for patients in particular, they really like that because for once they're in the chair and they actually understand what I'm saying and they understand what I'm doing. And most of the time, if I say to you, oh, you've got, a pocket of 6 millimeters on your lower left 7 and your furcation's visible, like, you don't know what, like no one knows what that means. But if I say, you have bad bacteria and it's red and it's above the threshold, everyone understands that. And it's much easier for you to comply at home with.
And what I love about testing, whatever the test, but it's creating initially an anchor point. And even if that first test is like a car crash, what your goal is to work from that anchor point and then see a pretty picture at the end of it. And that's what you're creating. And actually that was, to me, that sounded, I'm not a dentist, it sounded so easy. Well, of course, that's what you're going to do. You're going to test, you're going to do all of this treatment. It's going to sound, and you're going to come out the other side. But how many people out there are struggling with receding gums, with pockets, with loose teeth, with halitosis, and then the bigger conditions that I kind of see, the autoimmune, the neurodegeneration, the breast cancer. I mean, breast cancer and oral microbiome, we'd probably sit and talk for several hours about. So actually what you've done is just put solutions into place to say that there's answers out there and people don't need to be plagued with dental problems, do they?
No, and I think also what I try and do is make it as easy as possible for the patient. So I don't want to throw 20 products at the patient and say, take this, use this, try that. But it's about what toothpaste is good for your microbiome. And if you need a mouthwash, which mouthwash? Because there's a bit of a, should I use mouthwash? Should I not? And generally I say, don't use it. However, if if I prescribe you a mouthwash, it's because you specifically need it. So I create kind of like a prescription for the patient, and it's exactly, what toothpaste, what toothbrush, what mouthwash if needed, if they need any gels, supplements, and it should be very simple and it's not adding anything more. But the problem with, I think, general dentistry, the average dentist, is that it's not very prevention based. We're more of a general, as a community, we treat disease as opposed to preventing it, and that's the biggest issue.
And I also think a lot of dentistry, just like a lot of conventional medicine, is one size fits all. This is the mouthwash, which truthfully, and no disrespect, maybe because they've had a rep come round and go, hey, we're going to give you a good deal on this mouthwash. Now put all of your patients on it. Or, hey, this is the best toothbrush. And actually what you're saying is, which is what goes hand in hand with functional medicine, is it's an individualized approach to the patient. So it's patient-centered, not disease-centered medicine that you're creating. And I think also what I think beautiful listening to you, it's almost like somebody singing a song in my ear, is you're actually taking away a lot of the fear factor around it. And I've got so many patients that would tell me they'd rather go for a smear test than they'd go to the dentist. Like, I'm sure you know this as a dentist yourself. And I think dentistry is in your blood as well, isn't it? It's like your sister's
my sister's a dentist too. Yeah.
So I think they've got it in their bloodstream. But you must hear so many people with a hate language towards dentistry, not at you personally, but just what you represent.
Yeah, no, 100%. Everyone hates us.
and bless you, because actually you're doing an amazing job. And what we're going to get out of today is it isn't as painful as people think. And it isn't a case of you're just going to go in there and start pulling teeth out. And I think that's where some of the old style dentistry gave new style dentistry a bit of a bad name, didn't it? I think people who are in their
100%.
60s and 70s, that every tooth has got an amalgam fill-in or massive amount of dentures is just because you went to the dentist and they started playing around with amalgam. So what Victoria's done this evening is actually said there's options out there that don't involve that, you know, quite invasive dentistry. And the sooner that you get to her, the more likely that you are going to be to preserve teeth, isn't it? I mean, the sooner you intervene, and even before somebody's got the receding gums, the actually getting in there is so important. Now, you've only just opened up a new clinic, haven't you? You've just moved into a brand new premises. I got a guided tour before we went on live. Can you tell people where they can find you?
Yes. So we've just opened it's a health center called the Health Society. And it's basically, we've got 3 rooms for dentistry. And then we've also got an infrared sauna. We have a physio and rehab center as well. And then we're also going to be doing blood tests and IV drips and micronutrition as well. So it's all meant to be a combination and more of kind of a referral center for patients that, for example, I work with you, Joe, or, you know, that kind of thing. So it's in Mayfair. So it's 10 Lee's Place. And you can find me on Instagram if you'd like. And the address is there. But yeah, we'll be opening in 2 weeks. So it's super exciting.
Amazing. So we will put a link through all of our channels to Victoria's new practice. And the reason I wanted to bring her on tonight was to talk a bit more about the oral microbiome, because her knowledge far exceeds mine, but also to give you, the listeners, somewhere to go that actually is about making a difference and stripping away that fear factor around dentistry and just seeing it as part of our well-being. And just like people invest loads of money in looking after their gut microbiome, unless you deal with this microbiome, that microbiome is never going to get into balance, because it's a bi-directional relationship. It's an interface that goes through both. So we've really got to open up some of that other knowledge and power around microbiome. So thank you so much for your time this evening, Victoria. And like I said, we'll be sharing your practice throughout all of our channels, and keep sharing the word about the importance of oral microbiome. And we've found the person that can actually do something about it. So thank you so much for your time this evening. And thank you to all of our listeners. And please, please, please do share this recording, because if you're not affected by oral microbiome, your friends, your parents, your grandparents, somebody is going to be. So share it, because sharing is caring. Thank you so much to everybody. And thank you so much to you, Victoria.
Thank you for having me. Thank you so much.